Do you frequently feel like your heart aches sometimes? Or maybe you've noticed strange lumps in your neck, under your arms, or in your groin that don't go away. While these could be harmless, they might also be signs of something more serious, like a blood cancer called Anaplastic Large Cell Lymphoma, or ALCL. ALCL is a rare type of non-Hodgkin lymphoma, which means it affects the lymphatic system, the body's network of vessels and nodes that help fight infections. Think of your lymph nodes like police stations for your immune system. In ALCL, immune cells called T cells go rogue and grow out of control, forming tumors. It can happen in adults or even children, sometimes showing up after an implant, like a breast implant. Let's break it down so it feels less scary and more understandable. So what causes ALCL? Great question. The exact cause isn't always clear, but we do know some triggers. One common factor is a genetic change. Imagine a typo in your DNA, especially in a gene called ALK, Anaplastic Lymphoma Kinase. When ALK gets switched on by mistake, it tells cells to grow non-stop, like a car with a stuck gas pedal. This kind is common in young people and often responds well to treatment. Another kind, ALK negative, happens more in older adults and has no clear cause. Also, rare cases link ALCL to breast implants, not the implant itself, but the scar tissue around it after years. It's like how rust builds up around a pipe. Over time, the body's reaction might trigger cell changes. But remember, this is very rare, and not all implants cause this. How would you know if something is off? Let us play detective. Have you felt unusually tired, even after good sleep? Or had fevers that come and go without reason, like your body's alarm keeps going off for no intruder? Night sweats so heavy you need to change clothes. These are common clues. You might also notice swollen lymph nodes, firm, painless lumps, say under your arm, that do not disappear in weeks. Some people get skin rashes that look like bumps or sores. In advanced cases, the belly might swell if organs like the liver are involved. If you have had a breast implant, and now you feel pain or swelling on one side years later, get it checked. Your body is talking, listen closely. Diagnosis starts with a small piece of the suspicious lump, a biopsy. Think of it like taking a sample of bad soil to see why the plant isn't growing right. Doctors examine the cells under a microscope and run special tests to spot the rogue proteins, like CD30, that scream ALCL. Imaging tests, like CT or PET scans, help find other affected areas, like checking a building for hidden fires. Once confirmed, treatment depends on the type. If it's ALK positive, strong chemo, powerful medicine to kill fast-growing cells, works well, kind of like a smart bomb targeting only cancer cells. For some, stem cell transplant rebuilds the immune system. Newer treatments use targeted drugs like brentuximab, which attaches to CD30 like a homing missile. For implant-related ALCL, removing the implant and scar tissue may be enough. Every case is different. Doctors make a custom plan. Can you stop ALCL before it starts? That's the million-dollar question. Sadly, we can't prevent most types, since we don't fully control our genes or immune reactions. But here's the good part. For those considering breast implants, discussing risks with your doctor helps. Choosing textured implants, know they have a slightly higher link, though still extremely rare. Regular checkups and body awareness are your best tools. If you have a lump, fever for weeks, or strange symptoms, don't brush it off. Early detection isn't prevention, but it's the next best thing. It's like checking your smoke detector. You can't stop all fires, but you'll catch them faster. Good news, science is moving fast. Researchers are testing new drugs that target only the faulty cells, sparing healthy ones, fewer side effects, better quality of life. CAR T-cell therapy, where doctors modify your own immune cells to hunt cancer, is being studied for ALCL. Also, scientists are learning more about the biology of ALK and CD30 to design smarter treatments. For implant-related ALCL, better implant designs and early detection guidelines are in the works. Clinical trials are open worldwide, meaning patients can join and access cutting-edge care. Staying informed, that's power. Talk to your doctor, ask about trials, and remember, progress is happening every day.